When you consider that there's not a single drug treatment that's been designed that's available specifically for the purposes of treating migraine, that's a rather sobering fact, given the fact that migraine's been around for as long as we've been around. So that there's not one single treatment designed to specifically treat and prevent this disease is quite staggering, actually. There are very few treatments actually approved by regulatory authorities to actually prevent migraine. And of those that are, they're not terribly well tolerated and they're not terribly effective. Based on the two largest population-based studies that have been done, it appears that in the population of those patients who have episodic migraine, where it's less than 15 headache days per month, just a little north of 1 in 10 actually receive a prescription for a preventive treatment. And of those who have chronic migraine, which is more than 15 headache days per month, less than 1/3 are actually getting preventive treatments. And you have to ask yourself the question, well, if there are treatments available and approved with some evidence base, why aren't they receiving them? I think the reason why they're not receiving them is because physicians lack confidence in them and patients are not able to tolerate them and don't respond very well to them. Consider this statistic based on a recent study that was published where in a large group of chronic migraine sufferers, over 85% will discontinue the preventive treatment within a year. And while we don't know exactly the reasons why every single patient discontinued these treatments, those of us who care for these patients in practice will know that it's largely because of the poor tolerability and the lack of efficacy that's seen in a number of these patients. So there's a huge unmet treatment need when it comes to preventive treatment, arguably the biggest treatment need that these patients face and the biggest challenge that we as clinicians and providers face when looking after these patients. We're about to enter a very exciting era where there are disease-specific treatments against highly selected targets for the prevention of migraine. That will change the way we approach this disease, and it will change the way this disease is expressed. So there's hardly been a more exciting time.